what I want to present today is a product which is developed from Checkpoint Cardio, which is a medical company with the R&D structure, company which has been established from doctors with the aim to create a remote patient monitoring solution so that the patients are better observed and better cared. Since the times of Florence Nightingale, the observation of patients after ICU in the general ward is done manually and twice per 24 hours. In the ICU, the patient is observed constantly. In the ward is twice per day. And when released at home, 0. This type of drop of the observation frequency brings to a lot of preventable deteriorations and even deaths, both in hospital and at home. So the product which has been created is a remote monitoring medical solution, a wearable device which measures all vital parameters in real time and transmits those wirelessly to a medical professional team, regardless of patient's location. So it's just not in hospital device. It's a patient can be at home, can be on the street. In the last 3 years of the development of this solution, it was developed together with the 5 leading European university hospitals, which are Karolinska in Sweden, University College of London hospitals, Utrecht in Netherlands, Aachen in Germany, and Leuven in Belgium. During this period, the solution has been both certified and validated in a multicentric clinical trial for its accuracy and ability to perform as per the highest medical standards. So what is the product by itself? So we have a, as you can see here, it's a wearable sensor. That's the one part. This wearable sensor, the shortest explaining of functionality is that it's a wearable version of a bedside monitor or ICU monitor. So it has ECG with the possibility of 1, 3, or 12 lead. It has digital stethoscope, which is over the functionality of the bedside monitors. It measures heart rate, non-invasive blood pressure, oxygen saturation, respiration rate, body temperature, and the activity of the patient. The data, so the sensor is around 100 grams. It's very lightweight. It's with very high usability. The patient can wear it everywhere. And then it can stream the data to a dedicated servers or over a Wi-Fi network in the hospital or through a dedicated relay device, which is practically with the functionality of a smartphone, which sends the data to the medical professionals over 3G, 4G, and the standard cellular network. The system has then a web-based desktop application, which allows the medical professionals to enter from anywhere, from any computer, laptop, or tablet, and check for the patient from patient data, patient status. It also has a dedicated app for the nurse and medical professionals, where all the main patient parameters, vitals, alerts, trends, information and are actually displayed and also accessible. In addition to those vital signs and parameters, except the ECG, stethoscope, blood pressure, heart rate, and respiration rate, the system calculates a mean blood pressure. It gives the patient activity. It can, it can give a patient location. It has been used in several projects for patients with dementia for outpatient observation. It calculates the pulse pressure, estimation of cardiac output, QT interval in real time, which is important for certain deteriorations which appear as sudden cardiac death into hospital departments and very often remains unnoticed. It has also continuously measurement of the stress index and parameters of the HRV analysis, which are showing the way autonomic nervous system is responding to the condition of the patient, which is very much related with early deterioration detections and prediction. Also shock index, HRV analysis already said, a full HRV analysis. And then the system has two machine learning based algorithms developed with the universities I mentioned before. It's a news to early warning score. Automatic continuous calculation is something which is very important and standard in UK and many other European hospitals for daily calculation by the nurses and determining the level of the risk of the patient. So currently, this news to early warning score is manually calculated in the UK hospitals, in every hospital which is using it every day by nurses, and only twice. Until here, we have continuous calculations, which is more than 4,000 measurements per 24 hours. Then there is additional machine learning-based model, which is for deterioration risk of the patient, which is continuously calculated also, which stratifies the patients according to their risk of imminent deterioration. It tracks more than 60 different parameters from the patient physiological data in order to derive a proper calculation of and possible prediction of when and which patient is going to deteriorate. Then, as a product, as I said already, it's a CE certified, and in our certification, we aim to not place it as something not existent on the market, because this will, as you know, make an issue with the reimbursements and both of the devices and services. For this reason, we have been certified, covering standards of existing offline devices. So our sensor and then our solution is covering completely Holter monitoring device standard, blood pressure ambulatory monitoring device standard. So those two examinations now and those two devices can be combined with ours. Multi-parameter physiological monitoring, which is those offline which you have in the hospital, and in hospital telemetry type of devices which are just one lead ECG and nothing more. So in this case, we have 4 different offline devices existing in healthcare, which are combined in functionality of one online wearable sensor. On top of this, what we have more than any other company on the market is, as I said, the company has been established from medical professionals, and within the time frame of 8 years, it was developed a special type of medical entity, which is now is quite modern to be called a virtual ward. So this is a dedicated hospital department or standalone medical center with more than 200 specialized clinical workflow protocols for simultaneous observation for up to 1,000 and much more patients, regardless of their location. So these are some pictures of our remote patient monitoring center, which is currently serving 850 patients simultaneously in more than 6 countries. This is also part of our product. We have quite a lot of hospitals who want not just the sensors, but the full installment of a virtual ward with all the clinical organization, staff training and everything. because the continuous observation of the patient needs a dedicated staff and cannot be performed or difficult to be performed from the existing hospital nursing staff, as they have quite a lot more of obligations. We have a track record of more than 70,000 patients which have been observed so far in our own medical center. As I already said, it has been 8 years of development and operation. And we have quite well developed blueprints for deployment and transferring to interested customers. So what this solution has been proven so far and to bring us a benefit for our healthcare system and hospitals, possible customers, is a reduction of capital investments, because those 4 devices offline, which they should buy and they have now, cost quite more than our solution as a capital cost. Then there is significant reduction of the clinical costs, because this type of close to the ICU frequency of observation, regardless of patient location, with this tool, the medical professionals can release patients earlier from the ICU and earlier from the general ward, and they then continue the observation of the patient at home. That's how it is applied. And in this case, in such case, every home bed can become as a hospital bed. So the benefit for the hospital is quite big, of reducing of length of stay of patients in the hospital. Of course, improve patient safety, which is the main benefit of the system, because the early detection of any deterioration gives much more chance this to be mitigated, and possible escalation of care to be avoided. Then quite good, quite big interest as a benefit of our solution amongst those hospitals and universities who are interested in the research, is that our system provides all possible data for the patient. It's recorded and can be exported. The vital parameters are up to 4,000 per 24 hours. These are time series, very well suited for any type of machine learning algorithms and any type of data analysis, which now cannot be done with just 2 measurements, which they have in their patient files per day. And then the other possible advantage for the customers, what we have been detected so far with the customers we have been working with the hospitals, the system through the decrease of the ICU length of stay and then the general ward length of stay, has a possibility to the hospital to increase its capacity to perform operations, which is the main income from the hospital, without adding brick and mortar. In many countries, like UK, for example, now, and also most of the countries at the moment, there are a lot of postponed operations because of the COVID-19 crisis. There are a lot of waiting lists for standard procedures and the patient, and this kind of problem can be mitigated with adding a tool for remote patient monitoring, which can allow patients to be released earlier, both from the ICU and the hospital.
Boris, sorry to stop you, just let you know that you have 5 minutes before your time slot ends. So just
yeah, that's it. I mean, I finished.
All right. So the floor is yours, guys, for questions. Perhaps I start with one, Boris. Would you say that like your main business model is based on selling the hardware or the software option? And maybe a follow-up question: is the USP all the metrics you can actually measure? Is it like something very special and unique to your project, or is it like, since the competition is pretty vast in the telemedicine industry, like a regular portfolio of metrics?
Well, no, we have quite more. Actually, there are similar solutions on the market which are quite limited in their functionality, like, one lead ECG and respiration rate, for example, that's it. Or SpO2 and temperature, that's it. And there is not, there are no such which are covering full functionality of multi-parameter physiological monitoring. And hence, all those which I've shown, which are more than 40 parameters measured, cannot be covered from any other system. So all other systems are, let's say, kind of fragmented and are not suitable for whole hospital department, for any hospital department.
All right, thank you. I can see that Yuri is raising his hand.
Thank you. I just wanted to echo Boris' presentation. We've had a chance to meet with Boris in the past, and he is first of all serial entrepreneur with vast experience in setting up the businesses. And when we've seen the CPC, which we're working on now in our markets in Czech and Slovakia, Poland, we found it absolutely fascinating and in the great stage of development with strong endorsement from universities in the Western Europe. So they're absolutely keen to support it, and looking forward that the year from now when we'll be talking about CPC, it's going to be kind of standard in many markets on a very big scale. So kudos what you did, Boris, so far, and looking forward for working together.
Thank you. Thank you.
Boris, can I ask you a couple of questions, please?
Sure.
My understanding is that your system covers cardiac patients. Is that correct? Do you envisage remotely monitoring other morphologies, like, for example, respiratory failure or diabetes? Do you have any plans for that direction? And I also noticed that your virtual ward is probably manned with healthcare professionals. I mean, are these doctors and specialized nurses who can actually understand what's going on based on the algorithms you have and decide on an intervention or change a prescription of a doctor or call him? This is what I'd like to know, if possible.
Yeah, absolutely. So it's not just for cardiac. Departments. Actually, the system has been deployed in all type of. So the solution is, let's say, if we speak for the patient profile, for all patients which underwent surgical procedure, so all which has been in the ICU and then went out from the ICU in the general ward. So we have deployments in, for example, pediatric cancer hospital. We have in hematology departments, in general surgery departments, in emergency wards, for example, when the patient arrives in hospital for some emergency, and they are, and he's not, fit to be admitted to the hospital, but still. The hospital want to, have a track on him, so they put this device, send him back at home, and it's with wide implementation. So diabetes, concretely, let's say, to follow up the blood sugar, this we don't have in the sense that, but we have a project for developing algorithm for that, which is based on frequency analysis of PPG wave. There are quite a lot of research based on that. From the other side about the virtual ward is so the structure is the following. You have dedicated nurses who are observing the patients on shifts 24/7. And they are annotating. So they are annotating a possible events, possible pathologies, or whatever, which they find is significant about the patient. And this goes to doctors who are actually then taking the follow-up actions of if the therapy needs to be changed. It's especially good system for real-time therapy management. this is something, and yes, it has the biggest benefit for cardiac patients. Yes, but not only. We have been followed up at home, COVID-19 patients, patients with pneumonia, with with different type of conditions, and it has quite a broad aspect. So yes, therapy management is actually the main benefit, is the main instrument which. Clinical instrument which the system allows you to perform to the patient so that you keep him out from deterioration, keep him out from the hospital. That's what it is. That's the main benefit which this tool gives to the medical professionals.
So generally speaking, the patient is homebound. He's not ambulatory most of the time, right? It's like an extension. You're monitoring patients just discharged from ICU or hospital, and there's a period of time until they're relatively still sick, but you want to make sure that the condition doesn't deteriorate to get them back in the hospital.
That's one of the scenarios. The others, because I don't think we have time, the others is chronic patient health management. So for example, we won a tender for the Red Cross. We developed a solution for them where they are managing a chronic condition, patients with different type of chronic conditions for a 2 years period at home, and at the moment there's 600 patients which they're tracking, and there will be increase of this project up to 3,000 patients. So it's very good for chronic, of course, the best is for chronic heart failure patients, but not only for COPD and cancer patients. It's quite good, the system to evaluate the effect of chemotherapy, all these, heavy procedures which the patients are going. It has been proven quite beneficial there. So it's not just for spot diagnostic. Of course, our prime target at the moment for a market, because we're speaking for distribution here, is B2B, and those are hospitals. But management of chronic population, this is the biggest benefit for this tool.
So
the doctors can serve more than 300 patients per day compared to the office, which is 30. So it increased quite a lot the efficiency of the clinical stuff.
Apologies, Boris, I have to cut you off again. I will happy to connect you with Ben. You can discuss further with some follow-up questions. So thank you, Boris, again for your presentation. We will follow up with some further requirements for the presentation and the materials so we can share it on our internet.